Welcome to the Essential Video Guide to Cosmetic Rhinoplasty, presented to you by the surgeons and patient care experts of 8 West Cosmetic Surgery. The objective of this video is to help anyone considering rhinoplasty better understand if the surgery might be right for you. Following this video, you should be better prepared to answer these questions. Can I safely fit cosmetic surgery into my school, work, or family life? Am I comfortable with the potential risks and complications of surgery? Am I choosing a surgeon that specializes in rhinoplasty and has board certification in facial surgery? And am I ready to book a consultation? Should you decide to book a consultation, you will meet with board-certified facial plastic surgeon Dr. Buonassisi. He is an experienced and specialized rhinoplasty expert. Dr. Buonassisi has been in practice for over 10 years and makes rhinoplasty a large part of his focus. Dr. Buonassisi will be joining us shortly to tell you more about rhinoplasty. 8 West Cosmetic Surgery is a premier medical practice located in beautiful Vancouver, British Columbia. A unique focus of our practice is the 8-stage cycle of responsible care, a full-circle process to ensure our clients have a positive, satisfying, and facilitated experience. 8 West Cosmetic Surgery offers specialized services. Our board-certified plastic and facial plastic surgeons are experts in their field, practice cosmetic surgery in their area of board certification, and focus on either the face or the body. We are committed to educating. Our website provides a comprehensive source of information, and our knowledgeable patient care experts have many resources to share with you. We aim to make the experience simple, from our easy-to-access ground floor location and street-level parking to our virtual consultation, which makes it possible for out-of-town patients to meet their surgeon online before making a trip to Vancouver. We take our patients and their privacy seriously and have a confidential entrance. There are no busy elevators. We don't publish before and after photos on our website, however, extensive examples are available for viewing during your consultation. The consultation is designed to encourage an open dialogue between you and your surgeon. You will have ample time to discuss your objectives and questions and view computer imaging. Your surgeon will educate you on the potential risks and complications of surgery so that you can be well informed prior to making your decision. If you decide to book surgery, your patient care expert will ensure that you are well prepared and can effectively plan for time off work and activities and make arrangements for childcare if required. And finally, your time with us doesn't end when the surgery is finished. We'd like our patients to feel like they're a part of our family. We will schedule regular follow-up visits with you so that we can stay in touch and monitor your progress. I'd like to now introduce board-certified facial plastic surgeon Dr. Buonassisi so that you can learn more about rhinoplasty.
Hello, and thank you for joining us. So what is rhinoplasty, and why is it one of the most common cosmetic surgeries? In its simplest form, rhinoplasty is a surgery to change the size and shape of a person's nose. There are many reasons why people consider surgery. I often hear my patients say that they believe their nose is too big or too small, the tip is too bulbous or too low, the bridge isn't prominent enough, or they have a large hump that is bothering them. While everyone has different motivations for surgery, a common theme that I hear again and again is that my patients don't want to significantly alter how they look. They simply want a nose that does not take attention away from their other facial features. In essence, they want a nose that better suits their face. What is considered attractive? This is a question that's been studied for centuries. In facial cosmetic surgery, the concept of proportion is an important one. When it comes to what is globally considered to be attractive, we know that the human eye favors a combination of facial features that are in proportion with each other. What this means is if any one feature of the face is disproportionately larger or smaller than the others, that feature will become the focus of the face, as can be seen with this image. This woman has many attractive features, but our eyes seem to get stuck on her nose. So my goal when it comes to surgery is to find a better balance and improve proportion and symmetry. I want to achieve safe and appropriate changes to the nose without significantly altering how a person looks. Essentially, we want to create a better harmony of features. As you can see, a small change to the nose creates a shift in focus. Prior to this simulation, her chin appears to be slightly set back and perhaps a bit too small. This is because in comparison to her large nose, it does look small. While she has very pretty eyes, they are not the first or even the second thing that we notice. Following the simulation, her jaw and chin appear to be more appropriate for her face. And now that we're not focused on her nose, we notice her lips and her eyes. Let's talk more about my objectives when it comes to achieving appropriate results with rhinoplasty. My first objective is to create subtle, suitable, and natural changes. No one wants to look like they've had nasal surgery. Achieving natural results is especially important to me. Changes that seem natural are those that are in keeping with the patient's gender, ethnic background, and other facial features. Let's start with gender. There are some variations in the changes that facial plastic surgeons make to male and female noses in order for the results to look natural. In women, there's a natural bridge height and tip relationship. The bridge should sit slightly lower than the most projecting part of the nasal tip. This gives an elegant, slightly upturned silhouette on profile, which is both feminine and attractive. So if this is the line from the bridge to the tip, and the bridge is this area here, the bridge should sit slightly lower than the tip. When it comes to men, there is also a natural bridge height and tip relationship. In men, the bridge should be in line with the nasal tip. So a woman's tip would be out here slightly, whereas a man's would be more like this. Another important consideration for achieving natural results with rhinoplasty is the person's ethnicity. Natural ethnic features should be retained in order to ensure a natural looking result. As an example, it's quite common for our Asian patients to request bridge or tip augmentation. This certainly can be done. However, I have to be careful to augment the nose in a way that is consistent with a natural looking Asian nose. If I augment the nose too much, not only will the results look strange, the results might be unstable. The final important consideration for natural looking rhinoplasty results is to consider all facial features. Achieving a fine balance of facial features really requires considering the face as a whole and not the nose on its own. In the surgical consultation, I use computer imaging to help the patient visualize how changes to the nose affect the visual balance of the nose and the chin, the nose and the upper lip, and the nose relative to the patient's other features. My second objective when it comes to rhinoplasty is to make changes to the nose that are safe. To achieve safe changes, I use surgical techniques that ensure that breathing integrity is retained or improved. I also think in terms of risk mitigation. Hump reduction is an excellent example of a case where I need to make a good decision about how aggressively the hump can be reduced while creating a safe result. For patients who don't wish for their nose to be a prominent facial feature, hump reduction can have a dramatic effect in drawing attention away from the nose. While it might be tempting to substantially reduce a large hump, caution must be taken not to over-reduce the height of the bridge, as this will cause nasal collapse and secondary deformities. This is an example of a risk mitigation strategy that I employ as I make decisions about what degree of change to the nose is safe. Finally, my third objective with rhinoplasty is to set realistic expectations with each patient about what can be achieved with surgery. During the surgery consult, I encourage patients to come prepared to communicate to me how they want their nose to look. What follows is a discussion about what is and what is not possible, safe, or appropriate. It is through this open dialogue that I can provide a realistic assessment of what can be achieved with surgery for the patient. Computer imaging, in my opinion, is one of the most important parts of the process. Computer imaging allows the patient and I to have a concrete discussion about changes to the nose and how those changes will affect the rest of the face. What can be achieved with rhinoplasty? Patients have two broad goals. They're interested in reducing or augmenting their nose. Reduction is really about reshaping or refining nasal features. In this case, I will often make changes to the nasal bridge, the tip, or a combination of these. I'll also use certain techniques to reduce an overly wide or large nose. Nasal augmentation typically involves enhancing and defining certain nasal features and often involves implants. I can use Gore-Tex implants or cartilage from the patient's own septum. What can you expect, both from our staff and from the surgery itself, should you decide to have rhinoplasty? You will spend time both over the phone and in person with Melissa Mitchell, our patient care expert. Melissa is a supportive and kind ally who is here to ensure you have all the information you need for a satisfying experience. Melissa will provide and review with you detailed instruction for preparing and recovering from surgery so that you can arrange for the appropriate time off work and other activities. The surgery itself is performed under general anesthetic or intravenous sedation. It takes 1.5 to 2 hours to complete, and you'll wake up with a cast and splints in the nose to keep your new shape in position. You can go home the same day, but must have someone accompany you to drive you home and stay with you for the first 24 hours after surgery. If you're an out-of-town patient, our team will arrange the appropriate care for you if you're traveling to Vancouver by yourself. Most people take 1 week off work and feel comfortable being seen in public 1 to 2 weeks following surgery. How soon you are ready to make your debut really depends on the degree of swelling and bruising that you experience. Everyone heals differently. You'll feel fine and back to doing household activities the day after surgery. Light exercise 1 week after surgery and vigorous exercise 2 weeks after surgery. The nose takes up to a year to heal completely, so it's important not to sustain any nasal trauma after the surgery. While you will see the results of surgery in the first week, the complete result can take up to 6 months. You will wear the cast and splints for 1 week, and during this time most patients experience little to no discomfort. If there is discomfort, it's easily treated with pain medication. Not everyone needs it. All surgeries have risks. There are some risks inherent to all surgeries and some that are specific to rhinoplasty. When it comes to general risks, they include bleeding, infection, and poor wound healing. Specific risks to rhinoplasty, while uncommon, may include nasal obstruction, bleeding from the nose, need for revision surgery, or patient dissatisfaction with the results. Now that you've learned about rhinoplasty, there are several places you can go from here. You can schedule a complimentary consultation, and if you need more information, please call our office to speak to a knowledgeable patient care expert or visit our website. We're here to help and looking forward to assisting you. Thank you.